I want to start picking up on what Antonia just said, which is college students. And I was just reading this morning about the growing concern that college students who actually were at college are going to be coming home and they're going to be with their families, obviously some of them in high-risk groups, and the concern about what that might mean as we head toward Thanksgiving and people are considering their travel plans and folks are considering, well, should my kid come home from college? What's your thought?
Good morning, Chris. I think that is one of the biggest concerns because college students are part of this big swath of the country that we see potentially might be traveling for the holidays. And so just having them move from one part of the geography of this country that potentially might be more high risk to another or vice versa, you're creating this environment where you might have different communities sort of, bring those risks together. And we know that even though cases are rising in almost every state, we've seen sort of 46% increase in cases over the last 3 weeks, there are definitely areas that are harder hit. And so my suggestion really would be, an assessment of who's sick at home, who's vulnerable. And there really, what I regret is that there isn't more clear guidance about this, because I think what families need to consider is, should the students quarantine beforehand? Should they get tested beforehand? All of those are steps there. They don't, completely guarantee that your student may not potentially bring home that risk, but those are at least some steps in mitigation. The other is to stay safe during travel. The safest, of course, is if they have the capacity to potentially just stay on campus this year.
So 6 straight days of more than 100,000 cases. It's kind of daunting when you look at the way the numbers are going. And you've been warning about it for a while now, about how it was likely to get worse. What can we do right now to change course? Obviously, Joe Biden has his team in place, but that doesn't start until January 20th. Where should we all be looking to? What should we all be thinking about?
Chris, this is a particularly dangerous time. I can't underscore this enough, because this is different than what the summer and the spring, where we're looking at potentially having multiple epicenters of really increasing cases and strain on healthcare systems. And the guidance hasn't changed, maybe because it is so simple that people feel like there must be something else. Really, it remains that we need to take those personal measures of wearing those masks, of not gathering in large groups, of maintaining physical distance, and if we can help it, to not travel this year. What I see the states doing, this rolling back of reopening, I think it's necessary. I wonder if enough states are doing enough of that rollback. And the thing that's keeping them from doing that is really that we haven't really passed yet the next COVID Relief Act. As you heard from Antonia, just the impact that this had on businesses, passing that is going to allow us to roll back those reopenings and not make our businesses suffer. And that has to be our priority, because those two are tied together.
So let's talk about the good news, if we can. And that is Pfizer yesterday saying, they have this vaccine. Now, there are still hurdles that we have to get through. And one of them was talked about by the HHS Secretary, Alex Azar, who was asked this morning about distribution. Let me play what he had to say.
Anticipated that we will have enough vaccine by the end of December to have vaccinated our most vulnerable citizens in nursing homes and otherwise, and by the end of January, enough for all healthcare workers and first responders, and enough for all Americans by the end of March to early April to have general vaccination programs.
Early April for general vaccinations. Does that sound realistic to you?
I think, Alex, Chris, this is going to sort of have to play out on how they have. Operation Warp Speed has these very ambitious plans. What they're going to do is manufacture. The government's invested in manufacturing a certain number of doses to then take it to allocation, determining who gets it. And we know that it's going to be healthcare workers and vulnerable populations first, then distribution, then administration of these vaccines to people who need it, and then monitoring to make sure that there's no side effects. Now, these are all plans on paper, Chris. And as you know, the devil's always in the details. For example, even with allocation, right? There's Massachusetts, all the states are asked to create their own vaccine distribution plans. And Massachusetts is thought to potentially get, my own home state is thought to get between 20 to 50,000 doses, right, for the first phase. That's not enough for all the healthcare workers and high-risk patients. And so then they have to ask different facilities to pass in their plans of who should be getting and who shouldn't be getting the vaccine. It's all intricate. And in the end, in October, we know that CDC Director Redfield said that they still need federal funding to pull that plan together. So we don't know if that's going to come together. All this to say it is ambitious. We'll see if it actually plays out the way that they want to.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.